In this video, I'm going to be talking to you how to use the mobility tools, particularly the mobility balls. There are loads of different ones that you can get for this type of thing. You can get tennis balls or the soft type balls. You might find you've got spiky balls of any variety, or sort of with ridges and things like this. Or you might find you've got sort of firmer balls like lacrosse balls and stuff. You might have slightly bigger ones, you might have slightly smaller ones. There are a whole range that you can get. You might even find some that are semicircular, so they've got a little bit of a base and then they sort of roll a bit like a mouse ball used to be. There's a whole load of all sorts. It kind of depends on where you want to work as to what one is useful for you. My personal favourite and I tend to go to tends to be lacrosse ball, just because I find it's quite versatile and because it's firmer, it can withstand body weight. But like I say, any of the others are quite useful. There are a whole range of places that you can use the balls to work. I'm going to show you a couple today, but like I say, anywhere in the body you can find it's useful. The technique is exactly the same. It's exactly the same if you've checked out of any of our other videos on using sort of self-massage or rollers and things like this. It's exactly the same. So to begin with, I'm going to show you how you can work it in the shoulder area, because it's one that I quite often get asked about, of how to work and release across the shoulders, because they're quite tricky to get with rollers and stuff and balls. So ideally what you want is grab yourself a ball and something that you can lean against, whether it's a door frame, whether it's a wall, a bar, table, something that you've got head clearance on. I'm going to use the surface here. And then we're going to pop the ball against your shoulder, and then we're going to lean down into the surface like so, and then you can have a little move up and down. Ooh, as I drop my ball, up and down, finding that point that you feel sort of tender once you've done those exploratory movements. And once you've got that pressure and the spot that you want to work, you can just lean into it, allowing yourself to relax to that pressure. If you want more, you can have a little move of the head or a move of the arm, or if it's enough just leaning on it, just let yourself lean onto that pressure. And you can hold it there until it starts to feel like it's easier. Once it's feeling easier, you can move on and do the same on a slightly different spot. And then you can work 2 or 3 spots on one side, and then I would suggest switching to the other side, seeing how it feels on the other side. And then you can do that as much as you need sort of throughout the day. If spots are particularly tender, then what I would suggest you do is imagine it like a bullseye, and rather than working directly on where the sore spot is, work on some of the outer rings and just let yourself get used to this sensation. It will help release the area that is particularly tender. And then as you've worked on these outer ring areas, you might well find that that helps desensitize the particularly sore spot. So that's how you can work sort of through the shoulder. You can do exactly the same on the back of the shoulder, sort of around that posterior cuff area. You can do it laying on the floor, or you can lean up against a wall and do exactly the same against the wall, leaning, moving, pressing in, taking movements and letting it ease down. If after about a minute nothing's changed, I would just move on and find a different spot to work. So that's up through the shoulder area. Another area that can be quite useful to work is around that hip area. So you can use it on your bottom. So for the glute area, what you want to do is have the ball and you're sort of placing it around under your bum, where that sort of top corner of your pocket would be. So to do this, you're going to be laying on your back, place the ball under your bum, letting the leg out straight. Now when you're in this position, it should just feel like pressure under your under the glute area. It shouldn't be particularly uncomfortable. With the other leg, if you bend it up, you can gently rotate your weight over the ball so that you feel that pressure increase. You want it to the point where you are still able to relax, so you're not clenching around that glute. So you take deep breaths, let yourself relax around. As it eases, you can increase the weight, so you can increase the rotation over, or you can take little movement of the leg to include that soft tissue release. And again, working this area, I would do 2 or 3 spots and then switch to the other side. With this bit, particularly the glutes, I often find it's an area that's quite tender for people, and sometimes the firmer balls are too strong, but tennis balls and softer balls are too soft because you squish them. So a good way that you can kind of modify so that you get the pressures that you need is you can use a firmer ball, but if you're on the floor like I am, if you put a pillow down on the floor first and then the ball on top and then you lay over it, it should soften it a little bit. Or you can do it in bed, again, that sort of thing will soften against a chair, sitting on a chair. All this type of thing will help ease for you. And then, like I say, you can work this any way you like. You might find you're using it in the hip flexor area, you'll just need to lay on your tummy to do this. You might want to use it on your hamstrings. If you're wanting to get a stretch for the hamstrings, doing it when you're seated on a chair might be useful so that you can swing the legs. You might even just do it when you're sat at a desk and rolling the surface of your foot over the top of it and rolling on the ball under that is also useful, and again you can wiggle toes to get the stretch through there. So they're really versatile, you can use them anywhere, but the technique in terms of how you do it is pretty much the same regardless of the tool you're using. So hopefully you find that helpful and you target those spots you need, and if you have any questions you can ping us a message or pop in to see us in clinic.